Hello, everyone. We warmly welcome you all to our special program brought to you by Indian Achievers Forum. I'm your host, Vatika Singh. Indian Achievers Award is an honor that celebrates the people who went extraordinary to effectuate their aspirations and ideas. In this series, we emphasize not only on the struggles and achievements of the people, but also on the social contributions they made to their native land, India. Before introducing you all to our one such achiever, let's take a look at the small AV.
Indian Achievers Forum is driven by a full-fledged advisory board. The board consists of experienced personalities who have excelled in their respective careers. Together, the forum organizes conferences, events, workshops, exhibitions, trade shows, and B2B initiatives in India as well as abroad. Where there is passion, there is achievement. And where there is achievement, there is Indian Achievers Forum.
Today we have with us Dr. Rajesh Dere, who is the Dean of BKC Dedicated COVID Jumbo Hospital. He is also the Professor and Head of Department of Forensic Medicine, LTMMC SION, and a Nodal Coordinator of all Jumbo MCG. He is a doctor by profession and expertise in forensic medicine. Mr. Dere has a wide range of experience as academician, administrator, and medical legal consultant. The COVID 19 pandemic had hit people drastically, and they have worked relentlessly for this. Hello, sir. How are you?
Hi, I find ma'am.
All right, sir. So, before entering into the questions, tell us something about you and your professional journey.
Yeah, myself, I'm professor and head department of forensic medicine. Basically, I did my post graduation in forensic medicine. Then I did my law, then MBA in hospital administration. 20 to 22 years, I am teaching forensic medicine in medical colleges. Uh, uh, at present, government has deputed me as a dean of BKC Jumbo facility and nodal coordinator for all jumbos in MCGM. This is what is my educational qualification.
Right, sir. So, moving ahead, I'm really keen to know that what inspired you to pursue this particular field as your business and career.
Uh, what inspired me basically is that I thought I was interested in jurisprudence, that is the criminal justice system, in which I internally feel that yes, uh, everyone should get a fair justice and the law should be impartial. Along with this, I also thought that I have to be a part of hospital administration so that we all know the healthcare industry in the public sector is not at par with the corporate or the private sector as of now. So if I do some good thing in this, I can contribute in a large way for the healthcare management. And by virtue of this, I can help hundreds of needy patients, needy citizens of this country in managing the healthcare business. This was blessing in disguise for me that I was given this mammoth task of shouldering the responsibility as a dean of BKC Jumbo facility, which is the India's largest and first transit hospital having bed capacity of 2,500 strength, in which nearly 200 beds are of ICU and more than 12 beds are of dialysis. Along with this, BKC Jumbo facility, MCGM runs India's one of the biggest vaccination center, that is BKC Vaccination Center, in which we have vaccinated more than 500 beneficiaries till now, and we are privileged to get most of the celebrities, film stars, rich people, even though ours being a public institution.
Indeed, sir. So, moving ahead, we know for a fact that starting anything has never been easy for any one of us. So, what all were the challenging predicaments that you had to go through initially when you started this journey?
First of all, uh, let me say that this is the worst pandemic, health pandemic, I would say, in last 100 years. And what is started that this jumbo concept itself was first in India. Then there was no knowledge about, there was no trained person, there was no resource person who can guide us to manage such a 2,500 bed transit hospital. And in this crisis, where skilled doctors were deficient, manpower were in acute shortage, people, the number of positive patients were increasing day in and day out. So, in this pandemic, how to manage a transit hospital with least available skilled manpower, maybe in doctors category, healthcare category, or this transit hospital, if you take example, and the BKC area, this is the low-lying area of Mumbai city. For your information, Mithi River, which floods every monsoon in Mumbai, is hardly 70 meters away from the center which has been developed by Municipal Corporation and MMRD. So this was the mammoth task. No one to guide, least manpower, no skilled manpower available because of crisis. Then, being a transit hospital, how to manage this transit hospital in heavy monsoons in low-lying area, and over and above that, we all know there were two cyclones which have means hit the Mumbai zone, Tauke and the Nisarg, which was near to capacity of 100 miles per hour, and in that, to withhold this tent or the transit hospital was one of the, you can say, the worst risk we have faced as a team to manage our patient, to withhold the structural stability of this transit unit. So these were one of the few the crisis situation and the difficulties in managing this unit.
Right, sir. So, since we all have certain plans for our future, so what are your future plans?
Uh, Let us discuss about healthcare management, for which we are appointed by municipal corporation. My personal things do not matter that much for me in capacity of a dean of this biggest transit hospital of this country. My personal plan, and to be very faithful to you, which I have narrated to many television medias, to various medias, is that I should strive hard further also to check that all the public healthcare management provides healthcare facility at par with the corporate hospital. See, what is happening in existing public system is that the rich people or well-to-do people do not do not prioritize public hospitals uh, for their healthcare management. They usually prefer private nursing homes, private corporate hospitals, maybe by cash system or cashless system. So my plan in the near future, if the Municipal Corporation of Greater Mumbai or Government of Maharashtra or Government of India provides me an opportunity, maybe like this or bigger than this, to work hard and give my concept in uplifting the healthcare management of the public hospitals at par with the corporate hospitals, then I would be the happiest person. And I can vouch that I would put 10 times more hard work, better ideas than what we have practiced in BKC to manage the public healthcare system. Just for the information, I would tell you that BKC is the only public hospital in this corporation, maybe in India, that the patient treated at BKC, that is 30,000, we have provided the healthcare to all these patients free of cost at par with corporate hospitals. So this is what I feel. If I'm being provided opportunity by my corporation or state government or government of Maharashtra, I would I would like to see in near future, in coming 5 to 10 years, I would implement such policies in the healthcare management system that the needy and the poor people should get at par healthcare system with corporate hospital, and that too either free of cost or with minimum cost as decided by the government. As far as my own policies are concerned, my own future is concerned, I would prefer my life to be given to the public system, public healthcare system, and after that, when I retire or if I take VRS, uh, I would prefer to go in, this criminal justice system, maybe as a medical legal advisor or a practicing lawyer or an healthcare administration in which I can manage good hospital and provide better facilities for the needy.
Right, sir. So, moving ahead, you must be knowing about the Atmanirbhar Bharat campaign prevailing in India right now. So, what are your views on the campaign and how is your organization working towards it?
Atmanirbhar campaign by government of India is a noble concept, I would say, if that concept is applied and implemented in principle. It's a very noble concept because each country has to be self-reliant. That is what we say as Atmanirbhar. But somewhere, as far as my knowledge goes, healthcare management should be a part of Atmanirbhar, this Yojana by Government of India, and all these public hospitals should be prioritized in Atmanirbhar Yojana so that through this Yojana, adequate funds, adequate infrastructure, adequate manpower is provided to the healthcare public healthcare system by which the needy people, poor people should get best healthcare system in this country. And I would say we all know that if your health is good, then your mind is also good. You can work in a better way. So health should be prioritized in this Atmanirbhar Yojana.
Right. So, sir, first of all, congratulations on winning the Indian Achievers Award. I really want to know that what was the feeling when you came to know that you have won the award and who all were the constant supporters in this journey of yours?
Uh, yes, it's my privilege to get this one of the India's best reputed award, I would say, in which these awards are given based on the work output or what is your work culture given to this society. And I'm thankful to the team of the Indian Achiever Award to consider me for this prestigious award. For this success to get this award, my BKC team, I think, should get a lion's share of this because it is because of my BKC team, all healthcare workers at BKC who are shouldering this responsibility from day one of this pandemic and still going on, should get a lion's share of my award in this. Then I should thank Honorable Municipal Commissioner Iqbal Singh Chahal sir for this, and over and above this, Honorable CM of Maharashtra State, Sri Uddhav Balasaheb Thackeray, for providing me this opportunity and bestowing faith in me that such a big challenge can be shouldered by me. Then, over and above this, I would say the citizens of this Mumbai, credit should go to all the citizens of this Mumbai who kept faith in transit hospital. Because I would say in the first few weeks, when we started patient admitting, even the relative of the COVID positive patient were in fear that whether we will get a good treatment in transit hospital may collapse in monsoon, we may not get at par services like major hospital. So credit should go to the citizens of this Mumbai for bestowing faith in this. And we all under MCGM have worked hard, and as of now we have discharged near to 30,000 COVID patients free of cost with smiling faces. And thank you one and all.
So now, sir, since we know a lot about your professional role, tell us something about your social contributions also.
My social contribution, I would say, from my school life itself, I'm more socially inclined as a part of my family tradition. Uh, in school life itself, I was a part of NCC senior cadre, social service scheme in schools, where we visited all the rural areas in the state of Maharashtra to provide healthcare system or provide this our benefits to the farmers of this country. I belong to farmers community only, and in colleges also I was leading my student council for 5 years. I was a part of university representative in Aurangabad University. Through this, all the social schemes related to students' activity, student welfare, I have led this in my student life for MBBS also, for MD also, and again like this COVID pandemic, I was privileged to be working on ground for this Killari earthquake in Latur. This was one of the highest Richter scale earthquake of this country, in which the Killari village or surrounding area was devastated. And I was working in Killari village for nearly 21 days, right from providing healthcare facility, providing food packets, providing shelters in tents to all these poor, devastated people in this earthquake. And now also in Mumbai, I am being associated with many NGOs like Sneha is there, many such NGOs, reputed NGOs, more than 100 NGOs. I was a part of providing social security schemes. I can give you a better example of this. The females who are facing torture and harassment after marriage, for dowries, for social rehabilitation. So, this many more social activities I'm still going on, and I will continue to do so till God favors me of my physical capacity, mental capacity to help to all these needy people of this Mumbai city and this country.
Indeed, sir. So, before concluding this session, you know that IF is followed not only by mainstream organizations, but also those young minds who aspire to be like our achievers someday. So, what is that one message you'd like to give them?
Message for the life of for the COVID pandemic. You want to say. Before this, can I add one more experience? Means many a times I have been awarded by Government of India, international agencies. The 26/11 attack by Kasab in Mumbai, that is Taj terror strike. Uh, in that, I was a part of the investigating team, and apart from doing hundreds of postmortems for this the victims, I was also expert for these court cases against the Kasab, for which I was awarded by Government of Maharashtra, Government of India, Government of Israel, French, German, for my good work in Taj terror strike. In addition to this, the 26/11 2005 flooding, heavy rains in Mumbai, in which for nearly 5 days Mumbai was at stake. It was withheld. I was also spearheading this, and I got multiple recognition for this. As far as message, I would say to the citizens of this country, In relation to COVID pandemic or such health crisis, I would say all the citizens of this country should learn to stay with the pandemic. Now, such health crises may be repeating maybe every 5 years, every 7 years. We all citizens of this country should start living with this by various precautions. Government is doing a lot for we all. So this would be message for all the citizens of this country related to healthcare crisis. As a citizens of this country, I would give a message to all the citizens that our country needs support from each and every citizens of this country. Where we are lacking in getting good educations. We are lacking in good civic sense. I will tell you, if the citizens of this country support this government, maybe state government, government of India, by behaving properly by civic sense. I can give you example by not spitting on the grounds, by putting your kudas or kachra properly in the dustbins. This would get our country at a different level, not less than developed countries. So every citizen should take this responsibility and support the government.
And that, I must say, sir, is a great piece of advice. Thank you so much for joining with us today. It was a pleasure talking to you, and we hope that you
Thank you.
continue to inspire people of all ages forever. Thank you so much, sir.
Thank you, Vatika ji, Indian Achievers Awards, all the directors and functionaries, once again, to providing BKC and me opportunity and appreciating all such hard work me and my team has done, spending our hours together, risking our lives and our family life also. And that is what is good part in this pandemic. And I can assure you from BKC, whenever there is a need of our for any healthcare crisis, maybe to Mumbai, maybe to Maharashtra, maybe to our great country like India, we all healthcare workers will again work hard to will not spare a single minute and we will save all the citizens of this country in any health crisis, if at all, if it emerges in this country thereafter. Thank you very much.